Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today we're continuing our discussion on the E&M section of CPT. In my last video, I discussed the history portion of the E&M section. So if you haven't viewed that video yet, please go back and view it so that you can get a good understanding of the different types of histories involved in an E&M code. Just like the levels of histories, the level of examinations are the same by name. These examinations and their levels are similar to those we just discussed. That is, they become more and more involved as you move up the scale from a problem-focused exam all the way up to a comprehensive exam. The four kinds of examinations described in CPT are problem-focused, expanded problem-focused examination, detailed examination, and comprehensive examination. So let's explore each of these separately, but still look at these as a measuring or a measurement in your measuring cups like we did with the histories. We're still making our cheesecake. So look at these as a measurement that you're making with your cheesecake. All right, the first one is a problem-focused examination. It's just a pinch of ingredients, just a morsel, a smidgen, a morsel. It's just a small portion. The problem-focused examination is limited to the affected body area or organ system. It's one area that's affected or organ system. And remember, I don't know if you follow me on my medical terminology, I talked about how cells become tissues. A group of cells form tissues, a group of tissues form organs, and a group of organs form your body systems. Okay? So when we look at these examinations, just know that a problem-focused examination affects one body area or organ system. Okay, example, orthodontic treatment. Patient comes in with braces on their teeth, wire braces. I know they got these fancy ones now, but they have the wire braces on their teeth and they've got a wire that's poking in the cheek. And they've asked you as a physician to check the cheek and help correct that problem. Or when a patient came in yesterday and had blood drawn, and today they've got a big hematoma or a bruise at the site where the blood was drawn, and they want you as the physician to take a look at it. In both of these cases, the physician is concerned only with the problem at hand and one body area or organ system, and not with anything else that may be affecting the patient. The patient might have hypertension, diabetes, or other medical issues, but today they are problem focused. They are looking, your physician is looking at that one affected body area. Okay? All right, let's move to the next examination. Expanded problem-focused examination. Now we've gone from a pinch of ingredient to a third cup of ingredient for our cheesecake. The expanded problem-focused examination is amplified or broadened to encompass more than what was included in the problem-focused exam. In the expanded problem-focused exam, the physician, 1, examines the affected body organ or system, and 2, checks other symptomatic or related organ systems. For example, gradual hearing loss. Patient comes in with gradual hearing loss. Okay, the physician is going to check the bones around the ears. He's going to also check the eardrums and any related organs that may be involved or systems that may be involved when it comes to the ear. Another one is severe acne. Patient comes in with severe acne of the face. Well, your physician will check the face and the neck because they're so close, but he may expand it and even check the back. Even though there's no acne back there, he knows that from past experience with acne, it tends to spread. So not only is he just concerned with the face and neck, but he'll expand it and check the back. Okay? So in both of these examples, notice that the physician not only looked at the immediate problem, but also examines other issues through systems that may impact the complaint at hand. So what he's doing, he's expanding the examination. Okay? expanded problem-focused examination. All right, let's look at the next type of examination, detailed examination. Now we're at 2/3. We've gone from a pinch to a third. Now we're at 2/3 cup. With the detailed examination, the physician performs a more extensive analysis than with a problem-focused or an expanded problem-focused examination. During the detailed examination, the physician performs an extended examination of the affected body areas and other symptomatic or related organs. So in other words, the patient may come in complaining of one problem that could be connected or complicated by something else. For example, patient comes in with complaining of flu-like symptoms, nasal discharge, and painful teeth and gums. Well, the exam might show an infection of the upper respiratory tract, as well as an ear infection and sinus infection. Note that the physician is concerned about learning as many details as possible about the affected areas. Another example of a detailed examination is recurrent low back pain that radiates to the legs. The physician wants to get as many details as possible about the back and the leg pains, as well as find out why this pain is recurrent. Why is the patient having the pain over and over? Notice in this case, the low back pain impacts the legs. Therefore, it increases the exam to a detailed one by bringing more systems into play. Note that the depth of the exam, low back pain radiating down the leg, could be caused by several different reasons. A pinched nerve, a previous injury. There's a whole lot of things that could have caused that. So your physician needs to do a thorough check. So he's going to do a detailed examination. And let's move on to the last type of examination, which is a comprehensive exam. We've gone from a pinch to a third cup to 2/3 cup, and with this comprehensive exam, we're at a full cup of ingredients. During this kind of exam, your physician must be sure that every part of the organ systems is exposed and explored, and that every necessary component of a group of systems is investigated. So he's going to do as much as he can for this patient. For example, systemic vasculitis, a diagnosis of systemic vasculitis. Well, that means inflammation of the blood vessels. And because of this systemic vasculitis, your patient has decreased circulation to the legs. Well, the problem with that is that blood vessels are all over the body. Okay? Thus, vasculitis, or this blockage, could occur anywhere in the body that's preventing the blood to circulate to the legs. So this necessitates your physician to check many body systems as well as body areas. Another example is a patient with severe persistent obstructive lung disease, congestive heart failure, and hypertension. This physician has to look at all systems involved. Okay? So keep in mind that a comprehensive exam may involve more than one organ system and always includes performing the exhaustive check. Also keep in mind that physicians like to code for a comprehensive exam because they like to say that they always provide a thorough examination of the patient or a thorough physical of the patient. But it's very important for you as a coder not to confuse a comprehensive examination in CPT with a comprehensive examination in your physician's words. Okay? Make sure you can distinguish between the two. All right, now we've discussed the 4 types of histories as well as the 4 types of exams. Next, we will move on to the kinds of medical decisions that physicians can make. All right? See you guys in the next video. Thanks.